Hello, I'm Dr. Kate Chope from the Hospital for Large Animals. Today we'll be going over hind limb anatomy. To start with, this bony protrusion is called the tuber coxide, also the sort of your bony part of your hip that sticks out here. You've got your tuber sacroiliac up here, which is often known as a hunter's bump when it's prominent in a horse. This is also the Sacroiliac Joint region, which is the landmark of these two bony prominences here, but the Sacroiliac Joint encompasses this whole area here. This bony protrusion on the back of the hind limb is the tuber ischii, which are your seat, also known as your seat bones. And then the horse's hip joint, the actual joint of the femur to the pelvis, is going to be seated right in about here and is generally harder to feel due to overlying musculature. But their hip is actually here, and this is the point of the hip. Coming down the limb toward the front of the leg is the Stifle Region, which is going to extend a large joint, which is going to extend on each side of the front of the leg as well. Coming down the back, we get to the point of the hock and the front of the hock joint. This region here to here is what's known as the metatarsal region, and then the pastern. On the back of the metatarsal region, as in the forelimbs, will be your flexor tendons, your superficial digital flexor tendon, and your deep digital flexor tendon. Deep to those is the suspensory ligament, which is hard to feel due to the splint bones here and here. But you can feel the suspensory branches or see them in a finer coated horse on each side of the leg running right down here to insert on the sesamoids. The coffin joint region will be right along the coronary band, and you can palpate in this area for coffin joint effusion, and your coffin joint collateral ligaments will run down each side of the joint here and here. The Fetlock Joint is a soft space in between the suspensory branch and the cannon bone, and your digital sheath, or what's commonly known as wind puffs, will be on the back of the leg and be this soft fluid swelling on the back of the limb here, and sometimes as well visible on the back of the pastern.